On this week's edition, we're going to tell you about Mary Washington Healthcare's brand new graduate medical education program. So today I'm with Dr. Stephanie Goldberg with Mary Washington Healthcare, and Dr. Goldberg is going to tell you about a really interesting and exciting new program that Mary Washington Healthcare has just recently stood up for our community. So Dr. Goldberg, thank you for joining us today.
Thank you for having me.
So, Dr. Goldberg, you're running the Mary Washington Healthcare's graduate medical education program, brand new program. So why don't you just start by just telling us a little bit about the program?
Sure. Graduate medical education refers to the period of time after someone has graduated medical school where they go on to get advanced training in their desired area. It could be in internal medicine, it could be in family medicine, it could be in surgery. And as we as a healthcare system look at the needs of our community and evolve to meet the needs of the community, our focus has been on how do we train that next generation of physicians who can work here in Fredericksburg and provide quality care. So to that point, we have started an internal medicine and a family medicine residency. Today we are in the Family Medicine Residency Clinic, which is a brand new clinic set up. And we welcomed 21 residents to our healthcare system on July 1st of 2023.
That's super exciting. So again, the residents they've recently graduated from medical school and now they're doing their training in the field. And you plan to eventually expand the type of residency programs going forward, right?
We do. We've started with primary care because we know that's the greatest need in our community right now. And the two new clinics that we built alone have provided expanded access for everyone in the community. Our next plans are to start an anesthesia residency program, a general surgery residency program, and long-term a psychiatry residency program. There may be others as well.
That's really exciting, all with an eye toward training the next generation of physicians, and ultimately you hope that some of them will stay here in the Fredericksburg area and make their careers here. Is that fair to say?
Absolutely. We are hoping that not only we as a healthcare system, but we as a community really give these folks the support and the space to grow as physicians so that they can join us and feel part of us. So when we talk about training this next generation of physicians, we're not just talking about the health system doing this, but we're actually relying on the community as well to partner with us in this. And I think what you'll find is that you'll see advanced care provided in our community and a lot of resources which will really benefit everyone. We would love for you to come and join our family medicine or our internal medicine residency clinics. You can look on our website and they'll be able to navigate you to the appropriate location. And what you get in a residency clinic is lots of different eyes on you. You'll be seen by a physician. The residents are all physicians who've gone through medical school, and they're going to spend a lot of time going over everything with you in great detail and really understanding your needs. Then the resident is going to go and present to a licensed physician who you typically think of your licensed regular physician who you go to see, and they're going to work with them to create a plan with you and come back into the room and integrate you into that plan. You are going to have the opportunity to learn so much and really participate in your health care in a way that you may not have otherwise had the time or space to do.
And the residents themselves, I think you have 21 of them. How long is the program?
So each residency program is a bit different in time. The internal medicine and the family medicine residency programs are all 3 years in length. For example, general surgery program, when we start that, will be 5 years in length.
Where did the residents come from?
So they are from all over, but 50% of them are from the Northern Virginia area. And many of them have ties to the Mary Washington community. We even have one resident who grew up in this community, and it's been so great to see her enthusiasm for coming back to this area to really support the growth and development and partake in that community type of relationship. We apply for accreditation as an institution to train residents through what's called the ACGME, which is our accrediting body for graduate medical education. They come in and do an assessment to say whether or not we have the capacity, the resources and the expertise to train residents and to be able to provide them with a quality education to sign them off on their skill set and so forth. In the meantime, we've recruited faculty from all over the country who have experience with education. And we've also worked on identifying physicians within our own institution who are passionate about education and providing them with the resources to provide that training.
And the facility that we're standing in right now is off of State Route 3 in Spotsylvania, and you said your other facility is closer to the hospital, is that right?
Mm-hmm. Yes, but you'll also see residents throughout the entire healthcare system. They're providing inpatient care for people who are admitted to the hospital. They're in a lot of our multi-specialty clinics with other physicians as well. So our hope is when you come to the institution, if you're not interacting with them primarily through the residency clinic, you still will get the benefit of working with them in other areas. And then each year, we will continue to welcome another set of residents. So of the 21, 6 are family medicine residents and 15 are internal medicine residents. We are starting the interview process right now and recruiting process for the following year, and we'll welcome our next set on July 1st of 2024.
Is there a website where people can read more about the program?
gme.mwhc.com.
I really appreciate you being here with us and explaining this program to us. It's just another example of the great work that Mary Washington Healthcare does for our community and to keep our community healthy and well. So thank you for doing this.
Thank you for having us.
Okay. All right. So that'll do it for this week's edition. We appreciate you watching, and we'll see you next week.